When it comes to hair loss and testosterone, the only thing it seems that comes to mind is side effects, side effects, side effects. Side effects of finasteride, side effects of testosterone, side effects of testosterone taken with TRT, side effects of finasteride taken with TRT with addition of Arimidex, and it goes on and on and on. Questions never seem to end on my comment section below. Steroid-based culture is the norm today in the fitness industry, and most of our patients are from this age group of 25 to 35. This is the age group when most of our clients are engaged in some sort of fitness training, exercises, or the other. And rather than run away from the fact that some of them might also be taking testosterone, we need to embrace this in the interest of our patient so that we can empower our patients who often seek our advice, empower them with information and knowledge about hair loss and TRT, hormone replacement therapy. Though I am a hair transplant surgeon, I am often bombarded with so many queries every day, queries of all sorts, and I don't realize when my specialty boundaries, my specialty domain gets blurred, and one day I get into the boundary or the domain of an endocrinologist, and on the other day I am in the domain of the anti-aging specialist, and some days in the domain of the hormone replacement therapist. For you cannot compartmentalize knowledge. You cannot treat one organ and refuse to look at the other. As a doctor, you are supposed to have a bird's eye view of the complexities of the human body. And at the end of the day, all of us doctors seek to address the patient's queries in the best way we can. This said, no other specialty will understand the play of hormones on your hair and your hair loss and the psyche of the hair loss sufferer. And since surgical hair restoration is my field, me and my colleagues are best endowed with knowledge to deal with the mindset of hair loss sufferers whom we understand the most, be it TRT or any other medical treatment which has a bearing on hair directly or indirectly. And if my patient reposes faith in my treatment, in my knowledge, I would rather treat him holistically than refer him or confine him to the compartmentalization of subspecialty treatment. For hair loss is the chief concern of my patient. He might be taking hormone replacement therapy, but in most cases there's nothing more important to him than the hair on his head. So let us see how best to navigate this complex labyrinthine of hair loss, sex hormones, sex hormone blockers, and weight training. So if you are yourself concerned about this topic, you often find yourself battering your head against the wall, this video may just be for you. Testosterone and testosterone replacement therapy discussions come with different perspectives, different opinions, and different mindsets. Just like finasteride, TRT also has been demonized, and many refer to both with negative connotations. And when to this discussion you add Arimidex or an aromatase inhibitor, all hell breaks loose and this becomes a taboo topic. Which to me it isn't, because many of my patients have gone this way. So in this video, I try my humble best to put this jigsaw puzzle together for you so that you don't have to spend endless hours in searching the internet for solutions. An effort to make you understand things better, dispel your fears and guide you the best way I can in your hair loss, hair restoration and muscle building journey. It is an effort to make you not only follicularly wise, but musculoskeletally intelligent as well. So if there is an elixir of youth, it is testosterone. It brings the body back to life by increasing virility. Whatever makes you a man is what testosterone gives you. In short, it optimizes life. During puberty, testosterone acts on the body to increase the muscle mass, to deepen the voice. Testosterone puts hair on the chest and various other parts of the body as secondary sexual characteristics and makes the external genitalia grow. Throughout a man's life, testosterone also helps in assisting reproduction by making the sperms and keeps up sex drive. It causes a feeling of well-being and gives strength to the bones and the joints. Women too make testosterone. It is made in their ovaries. It helps women to maintain hormonal balance and regulate other body functions. The first sign of decrease in the level of testosterone is decrease in cognition or brain fog. You took this huge insulin bomb of a lunch and now you don't have any drive. There is no energy left in you. You just wish to go home and relax, take a nap. So this is the number one symptom of low testosterone: lack of drive, lack of energy, and decrease in cognition. Other symptoms are indecisiveness, listlessness, some depression, irritability, and a low sense of well-being. Low testosterone saps your energy completely, tanks your libido, makes you lose your sleep. You cannot really focus on the work at hand, and your muscle mass decreases. With low testosterone, you cannot build muscle by weight training like you otherwise can. Low testosterone is also considered as a risk for Alzheimer's. Well, that is a very interesting question. Our ancestors, just about 2 to 3 generations back, had much more testosterone. It is surmised that it was 3 times what the average guy has who's walking the street. This is because they were living in agrarian communities. Their diet was Spartan, less carbs, more proteins, more hard work outdoors, tilling the land, rearing cattle and goat and sheep, carrying heavy weights on the shoulders, on the brawny shoulders, and they slept according to the sun. What we call in scientific terms as the circadian rhythm which follows the sun cycle. They too had stress, but their stress was momentary, not this continuous stress that saps us physically and psychologically. Most of us have stress of work, stress of relationships, and so many other stress factors come into play in modern living. They did not have blue or white light surrounding them all the time of the day, even at night. They did not have cell towers surrounding their place of work, their place of residence, and cell signals shadowing them all the time, whether awake or at work. They didn't have charging stations kept next to the bed when they slept. We do not realize or often ignore the fact that all this electromagnetic radiation is causing considerable harm to our endocrine systems. And then there are conspiracy theorists who would like to suggest rather macabre reasons for us having low testosterone. They suggest that there's something big, a devious plan to entrain us or to reduce us as a human race. 5G networks and this COVID crisis, which is prevailing presently, are prime examples that they quote. This belief is strengthened by federal authorities trying to restrict on who can take testosterone and who cannot. The way our lifestyles are changing, the way mankind is evolving, the choices that we make, and how we increasingly opt for technology in our lives will have permanent effects on our biological systems, and our testosterone levels of the human race will continue to get knocked off with every passing decade. The Hebrew University has gone one step further, and it has predicted in a paper that by the year 2045 or at the most 2050, mankind will be infertile. So if you are a young man doing everything right with the right genetics, your testosterone level, that is the total testosterone level, will range between 650 to 900 nanograms per deciliter. The free testosterone will be somewhere in the range of 17 to 25. To be more precise, normal testosterone levels between the age groups of 19 and 49 fall in the range of 249 to 836 nanograms per deciliter, and in the higher age groups, that is beyond 50, they are in the range 193 to 740 nanograms per deciliter. After we achieve the prime of youth, which they say is at 30, testosterone levels in the body decline every subsequent year by 1%. So when you get to 60, your testosterone levels are 25% of what they were at, say, 25 to 30 years of age. But the average man walking the street does not have any inkling that he has subnormal testosterone levels circulating in his body. Several models have been invoked to explain the role of DHT in men. A widely held view is the fact that the conversion to DHT is obligatory to mediate the effects of testosterone on the body in those tissues in which the activity of 5-alpha reductase is high. Tissues like the scalp and the prostate, which have high 5-alpha reductase activity, but not tissues like the bone, the joints, or the muscle. In these tissues, 5-alpha reductase activity is less, and conversion to DHT is not required for the action of testosterone. So this is nature's way, a brilliant way of enhancing or amplifying the effect of androgens on certain tissues by converting testosterone into DHT. This sensitivity or this enhanced effect of androgens on certain tissues, irrespective of a rise in testosterone levels, is a brilliant mechanism. There are some tissues which have high 5-alpha reductase levels and others which do not have high 5-alpha reductase levels, like the bone, the joints, and the muscles. So 5-alpha reduction of testosterone is not essential for all tissues in the body, tissues on which testosterone exerts its effect. The net androgen effect on any given tissue can be viewed as a function of the prevalent intra-tissue concentrations of testosterone and DHT and their relative androgenic potencies. In tissues with low steroid 5-alpha reductase activity, like the bones and the muscles, intra-tissue DHT concentration is very low as compared to that of testosterone, and this can be discounted, and the androgenetic effect ascribed merely to testosterone. On the other hand, in tissues which have high 5-alpha reductase activity, like the skin and the prostate, the intra-tissue concentrations of DHT are much higher than those of testosterone. It has been noted that males with steroid 5-alpha reductase deficiency exhibited ambiguous or female external genitalia and poor prostate development at birth. But the same category went on during the puberty transition phase to develop normal bones and normal muscle mass. So the phenotype of these patients who have 5-alpha reductase deficiency suggests that 5-alpha reductase plays an essential role in the development of the prostate and the phallus by causing local amplification of the androgen signal without causing an increase in testosterone, without causing hyperandrogenemia during the critical phase of sexual differentiation. This illustrates nature's extraordinary ingenuity in creating mechanisms for tissue-specific amplification during development. So with these facts in the background, we can speculate that in adult men in whom tissue-specific amplification of androgen effect is not essential because of circulating testosterone concentrations which are higher than those in the fetus, testosterone and DHT can interchangeably subserve the same function. But when circulating testosterone concentrations are low, intraprostatic DHT concentrations become important in maintaining prostatic growth, thus buffering the effects of low testosterone. This is such an ingenious mechanism that has been devised by nature. Now, TRT or testosterone replacement treatment is in vogue since many years now. Patients with low testosterone levels, patients who have symptoms specific to low testosterone, to maintain a better lifestyle, to maintain a sense of well-being, and to maintain musculoskeletal health are often recommended to go on testosterone therapy. That is exogenous testosterone replacement therapy, which we refer to as TRT. However, there is another coterie of patients who are bodybuilders, who take part in bodybuilding championships, who need to have a chiseled muscular look, who take super pharmacological doses of testosterone. Testosterone philics, and there's a whole breed of them, believe that the testosterone molecule is a life-transforming molecule. We are concerned about the super pharmacological doses of TRT. Super pharmacological doses which can have effect on hair, have effect on the heart, the liver, can cause gynecomastia, and many other effects on several other organs on the body and cause deep anguish. Very high levels of testosterone may make you susceptible to deep vein thrombosis, that is clots in your calves. It can also cause elevation of bad cholesterol. Excess testosterone can cause apoptosis or cell death. And remaining within the ambit of this topic of hair loss and testosterone, it causes death of the follicle cell or apoptosis of the follicle. And this effect is not linear, it is algorithmic. So these fantastic doses of testosterone need to be condemned, and they are also not legal to prescribe in most countries. Generally, it is accepted that when the testosterone level drops below 400, and if the patient is having symptoms of low testosterone levels, TRT, replacement of testosterone, can be initiated. You go bald with TRT only if you have the male pattern baldness gene, not otherwise. So if you have androgenetic alopecia, increased levels of DHT are only going to accelerate the inevitable. A person who is not susceptible genetically to DHT may take as much testosterone he wants, but he will continue to have a head full of hair. The 0.1 to 0.3% testosterone, free testosterone that you have in your bloodstream, is destined to become DHT on one hand through conversion by 5-alpha reductase enzyme, or through the aromatase pathway, God forbid, into estrogen. DHT, as we all know by now, is the potent form of testosterone. It activates the androgen receptor on the scalp. It affects gene expression and suffocates the hair follicle, leading to miniaturization or shrinkage of hair. So for baldness to happen while taking testosterone, you need to have genetic propensity. Finasteride may be able to fight hair loss when testosterone levels are normal or slightly elevated, but finasteride gets completely overawed with super pharmacological doses of testosterone, which some people take. One of my patients told me that no amount of muscle can compensate for a bald head. So stay away from exogenous sources of testosterone if you have normal body testosterone levels. Yes, and women also who take testosterone will experience male pattern baldness. Well, DHT is a devious and a cruel hormone. It is ironical that on one hand, it gives hair to your chest, to your beard, to your pubic mound, and takes away from the hair on your scalp. It giveth and then taketh away. There are people who take testosterone but have a head full of hair all their life because they don't have male pattern baldness. They do not carry the baldness gene. Well, for the others, the trade-off is between feeling happy, feeling more fulfilled, and having a head full of hair versus remaining foggy, irritable, with lack of energy and drive and virility. So most people with low testosterone levels opt for the former treatment, that is testosterone replacement therapy, and continue to engage with a hair loss doctor who recommends various hair loss treatments and protocols to keep the hair on their head. With proper advice, you can continue to be on TRT and at the same time make up for the lost ground, grow your hair back with proper medical advice. Yes, free testosterone, if it circulates in high levels, can aromatize and form estrogen. If the levels of estrogen so achieved are high, it can lead to moodiness, sudden mood fluctuations, can lead to puffiness of the breast, and various other symptoms which are peculiar to the estrogen hormone. But it surely will not make you a female. You will not find yourself weeping in movies. Yes, it does. Finasteride can increase the levels of estrogen in your body because it elevates the level of testosterone, because less amount of testosterone is being converted into DHT. So when the levels of testosterone pile up in the blood, excessive levels of testosterone find themselves being converted into estrogen through the aromatization pathway. Well, nature has stacked up so many unfavorable variables against you when you carry the baldness gene, and this leaves you very little room for maneuver. So with this background, making certain decisions which are impulsive, made at the spur of the moment, misguided decisions on hearsay, letting non-medical professionals and anonymous forum posters guide you all the way in your hair loss journey makes matters much worse. This is a short recipe, a short way to lead you into a labyrinth of dejection, depression and dismay. Yes, therapeutic TRT in those who have low testosterone can very easily be combined with finasteride without any problem. No, it is not. It is not so much a therapeutic dilemma like it is made out to be. Why? Because finasteride blocks 5-alpha reductase that reduces the level of DHT only in the scalp and the prostate. It does not have any effect on the muscle because muscle, bones and joints do not require testosterone to be converted into DHT for musculoskeletal health. Well, finasteride does not block all your DHT. Still about 25% to 35% of DHT is left to exert its salubrious effect. Finasteride merely lowers DHT levels. It does not annihilate them. So these are the symptoms that are listed in this chart of patients who have low testosterone, the symptoms that are specific to low testosterone circulating in the body. You should note that a person might have low testosterone levels. A patient with low testosterone levels may not have these symptoms. If a patient who has low testosterone levels has all parameters which are normal otherwise, he's a happy person, has good musculoskeletal health, TRT should not be advised in him. This is the area where TRT treatment is being misused, and this is to be condoned. Usually when you are dealing with patients who are having low testosterone, patients who want to be on TRT, patients who have hair loss, patients who are going on to finasteride, there are certain baseline parameters that need to be evaluated and which I do in my clinic. They might not be relevant all the time, but there is a baseline study which will always be helpful as you follow up patients in the years to come. Because once you start TRT, once you start finasteride, there is no way we will be able to assess what the baseline parameters were. I routinely, in select patients, would like to do total testosterone levels, free testosterone level, SHBG or sex hormone binding globulin, estradiol, and sometimes estrogen testosterone index. Well, erectile dysfunction has numerous causes. It could have a physical cause and it could also have psychological causes. And of course, hormonal causes, hypogonadism, can lead to erectile dysfunction. It is so common today in the age group of 25 to 35. It has been extrapolated that about 40% of this population has some sort of erectile dysfunction or the other. But the most common cause today is because of excess body fat due to insulin resistance, leading to endothelial dysfunction which causes erectile dysfunction. Obesity and alcohol play a major role in erectile dysfunction. Placebos today are the most commonly taken medications worldwide, and testosterone boosters, to my mind, are one such placebo. Testosterone boosters can contain T-aspartic acid, zinc, Tribulus terrestris, vitamin D, fenugreek, garlic, DHES, or the Ayurvedic herb ashwagandha. The effects, if at all, will be mild and very transient. Adaptogens or healing herbs or non-toxic plants are marketed as helping the body to keep various stressors at bay. Stressors that may be physical, chemical and biological. They are said to lift your mood when your mood is low and to calm you down when you are feeling uncomfortably high. These herbs have been used since centuries in the Chinese system of medicine, in the Indian Ayurvedic system of medicine, but of late they are seeing a renaissance of sorts. See, low testosterone level and TRT are not to be linked. You take TRT treatment only when you develop symptoms, not otherwise. This is not a numbers game after all. If you feel good, if you are up and about, very active lifestyle, very intelligent, doing well in your business, in your profession, high energy levels, there is nothing to worry and you need not start on testosterone replacement therapy. I don't think today, in today's times, there is any shaming for people who have been on TRT or who are going on TRT. Well, in certain conservative societies, this may still persist. But the pushback that you get from society, from your near relatives or from colleagues, is a choice that you yourself allow. There is nothing wrong in seeking therapeutic testosterone. It is perfectly legal. Yes, it is. You cannot take it for 5 years and then decide that I am going to stop it. Or you start TRT and say that after some time I'm going to stop it and then I'm going to go on natural testosterone boosters. For the simple fact that when you are playing with the body's hormones, it is not so easy to switch off and switch on testosterone by mere impulse every now and then. You need to realize that there is a hormone called gonadotropin releasing hormone. When you are on exogenous sources of testosterone, the body switches off gonadotropin releasing hormone. And at the same time, the testes will stop making testosterone. Say if you take a 3-month trial and then go cold turkey, stop testosterone replacement therapy completely. Since the body has stopped making testosterone, your testosterone levels are going to funnel. You will feel horrible. It will take some time before the body recovers from TRT and starts making its own intrinsic testosterone. This may take several months, and whenever it recovers, it may not recover 100%. So, being casual with TRT treatment is not advised at all. You have to be very circumspect when you're playing with your hormones. Take medical advice throughout whenever you do so. Many times when testosterone levels do not return back, you might have to take HCG injections, human chorionic gonadotropin injections, because the body is not making enough gonadotropin releasing hormone, because you've been playing too much with the hormones of the body. If you have gone down the pathway of TRT, you have to be serious about it, or be ready to face metabolic consequences. Well, that is a chicken and egg situation. Testosterone is lipolytic. Testosterone increases basal metabolic rate or BMR, and it upregulates thyroid hormone. Also, contrary to popular thinking, a healthy amount of estrogen is required for reducing body weight. If you see, the bodybuilders of the 70s and 80s had better chiseled bodies and more muscle mass than those seen today. And that was despite the fact that they never knew about aromatase inhibitors like Arimidex. It is being proven again and again that the estrogen dominance theory, that estrogen pile up or build up, causes increased body fat, is a myth. Increased body fat, it is being realized, is because of insulin resistance. Insulin resistance that leads to accumulation of body fat, visceral fat, and high estrogen levels. Well, in this situation, since body fat is the cause of increased morbidity and mortality, you should think of correcting this first before approaching the doctor, because the doctor is also going to tell you the same thing. And then if your hormonal levels are still low, you have reduced your body fat, then seek the advice of a doctor. Seek the advice of the doctor for your low hormonal levels or for that obstinate fat which is not going. Tell him about what you heard about testosterone and its good effects on the human body before your doctor starts talking about HCG replacement and all the other stuff that he knows. So in short, go to a doctor who is conversant with testosterone replacement treatment. We all keep talking about testosterone supplementation, estrogen optimization, but we need to take a step back and think about thyroid optimization. For thyroid is interlinked along with testosterone and estrogen as far as hair loss and weight are concerned. So it is a complete hormonal optimization you should aim for. There is no way you can optimize testosterone while ignoring the play of thyroid hormone. And this is also true the other way around. So to know about the interplay of various hormones in the body, how they are cross-linked, how you cannot consider one in isolation and ignore the other, all of them have an effect on hair. So to understand this, you need to know about the hypothalamo-pituitary axis, which is called, in short, the HPA axis. The integrity of the hypothalamo-pituitary axis is essential for the survival of all vertebrates, of which humankind, man, is one. This neuroendocrine axis functions to coordinate neural, endocrine, and immunological responses to diverse stimuli that threaten homeostasis. The final product of the activation of HPA axis is the production of glucocorticoids that exert widespread function on the human body, including cellular metabolism and immune function. Inappropriate secretion of endogenous glucocorticoids is potentially damaging and can predispose to illness, to disease. Homeostatic regulation of the HPA axis is complex, and it involves a coordination of multiple systems of the body in part mediated by the bidirectional communication between the brain on the one hand, the endocrine and the immune systems. Health and integrity of the human body relies on the appropriate integration of stress signals, including pro-inflammatory messages generated at central and peripheral sites. Functional balance between pro-inflammatory and anti-inflammatory mediators is fundamental to the appropriate control of the HPA axis and the prevention of dysregulation in its activity, which is a characteristic of numerous stress-related disorders like chronic inflammatory disorders. So as we have already discussed before, low testosterone can be because of various reasons: obesity, lack of sleep, excessive electromagnetic radiation, excessive dirty diet, and less outdoor activity. Number one is do not be overweight or obese. Besides causing inflammation, it lowers the total and the free testosterone. It increases SHBG. It reduces the insulin signal. So focus on less body fat, live a clean lifestyle, which is relatively stress-free. Avoid exposure to blue and white light. Do not live around cell towers, which is easily said than done. Don't keep your cell phone or your charging station next to your body when you are asleep at night. Have a clean diet, exercise outdoors, do cardio exercises, and sleep as per the sun cycle. Sleep deprivation is the biggest systemic influencer of inflammation. Some say it is even more dangerous than excessive body fat. Leading a non-inflammatory lifestyle helps by minimizing your insulin signal. Yes, alcohol is one of the determinants of body fat. Excessive intake of alcohol will increase visceral body fat. In a study, it was found that if you are off alcohol for 2 months, that is 60 days, only 1% of people will see recidivism. That is, they will get back to alcohol. The number one and most common formulation is injections. Injections come in various formulations. These are various esters of testosterone: testosterone propionate, testosterone enanthate, testosterone cypionate, and then we have testosterone suspension. All these esters have different half-lives. That of testosterone enanthate is 5 days. Cypionate is a longer acting testosterone ester with a half-life of 7 to 8 days, and propionate only 2 to 3 days. Testosterone suspension is the most potent form of injection. But since its half-life is limited, it requires more frequent injections. Testosterone suspension being very potent and requiring almost 2 to 3 injections or sometimes daily injections is not considered very safe. The only safe esters of testosterone are testosterone propionate, enanthate, and cypionate. Daily injections of testosterone are recommended because they most closely simulate the daily pulsatile release of testosterone. And then we have creams and gels. We have patches, which can be a skin patch or a mouth patch in form of a chewing gum, which is stuck to the oral mucosa just above the upper 2 incisors. And then we have implants. They are small pellets which are inserted just below the subcutaneous tissue. And lastly, the oral form of testosterone, which is not very well recommended because it has in many cases been seen that it has an adverse effect on the liver. Testosterone creams come in the dosage of 200 milligram per gram of cream. When you're taking the injection, the duration of action depends upon which ester is being used. For example, when you are taking the long-acting injection testosterone cypionate, it is used in the dose of 150 milligram taken every week because its effect lasts a week, and it is delivered in the subcutaneous area. That is a sub-Q injection. Bodybuilders take super pharmacological doses up to 1000 to 1500 milligrams in a week. And this can cause, besides systemic problems, it can also engage them in road rage and in frequent bar fights. Creams are known to have an 8 times better absorption rate when applied to the scrotal skin. They are applied most commonly twice a day once in the morning and once in the evening, and they are increasingly being preferred over the injection form. It is said that creams, when applied, give better sexual function. The DHT spike, which happens after application or injection of testosterone, happens better when the cream is applied directly to the base of the scrotum. And since DHT is 8 times more androgenic and anabolic, creams have a better effect on the sexual function. But as in life, anything that has a benefit also has a flip side to it, and so does the cream form of testosterone. Cream form of testosterone is known to spike the level of estrogen in the body. Increased aromatization of testosterone leading to conversion into estrogen. So if you are susceptible genetically, there is an increased chance that you will have puffiness of the breast or gynecomastia. The feminizing effect of estrogen is not so much that it makes you start to weep in the movies. No, it's not so bad. So for those who say that hormonal levels are not essential before starting the patient on finasteride, I would like to say that what would you tell the patient if he has tomorrow an erectile dysfunction? An erectile dysfunction which he ascribes to finasteride. What will you say to him? And what happens if the patient decides in future, while being on finasteride, to go for TRT as well? So to monitor a patient today, it is an error for not going in for basic hormonal profiling before initiating the patient on finasteride. It is not really essential. Only a very small percentage of patients will land up with symptoms of low testosterone. So it should not be done as a matter of routine. They may not help, but they surely create a psychogenic effect on the patient and make the patient think, introspect, and detect pre-existing or coexisting conditions like erectile dysfunction, which are so very common in the age group of 25 to 35, the age group when you have hair loss, the age group that goes for TRT, and the age group that is taking finasteride. This is also the population, according to my Google Analytics, which most commonly watches my videos. If you're between this age group of 25 to 35, you need to know what is going on in your body, especially when you are exercising a lot, taking various boosters and supplements, experiencing hair loss, taking finasteride, or when you are planning to go in for TRT or testosterone replacement therapy. It is so very simple to get a blood test done today. Your lab report might not be a symptomatic diagnosis. It may be just merely a lab measurement, a number. But in such circumstances you are in, it is essential for you to have it just to understand where you stand. There are so many people in this age group who are suffering from insulin resistance, metabolic disorder, and obesity, that planning any drug regime, or for that matter even a simple exercise routine, without knowing these basic parameters is an effort in futility. Firstly, because lab tests have become so easy to get, and then we are living in such a toxic environment. Our biological systems are relentlessly bombarded day in and day out. There is an ongoing war on our biological pathways, and there are so many other compounding environmental factors, various variables that our bodies are increasingly finding it difficult to modulate our hormonal environment. In this day and age, to have all the parameters within normal limits, you have to have very good genetics. If you wish the whole battery of tests, the most important tests are total testosterone levels, free testosterone levels, SHBG, and estrogen levels. I will not advise DHT levels because DHT elevation or DHT decrease is of no information to us, because the susceptibility to DHT is what determines hair loss and not the amount of DHT which is circulating. It is the tissue level of DHT which is more significant when hair loss occurs. SHBG is a protein which prevents the utilization of testosterone by binding to testosterone molecule. You may have high testosterone levels, but when they are bound with SHBG, they are of no use to the body. And that is the limitation of knowing total testosterone levels. It is the free testosterone level which is not bound to SHBG The free testosterone level has the effect on the body and not the total testosterone level. Well, this is the difference. Though total testosterone level can diagnose hypogonadism, it is no reflection whatsoever on the availability of testosterone to the body for its bodily functions. You may have super high levels of testosterone, but if you do not have adequate amounts of free testosterone, it is of no use to your body. There are two drugs. One is HCG, or human chorionic gonadotrophin, and the second one is clomiphene. Free testosterone can be increased by boron, and chances are that you have never heard of boron. Boron increases free testosterone within a week of its use. However, it decreases the total testosterone level by up to 39%. The flip side to boron is that if you do not stop taking it after some time, your estrogen levels are going to rise. Though boron decreases SHBG, or serum hormone binding globulin, if taken for a long time, its effectiveness decreases. So boron, when taken, has to be taken intermittently. You can continue to reap the benefits of boron by using it continuously for 2 weeks and then for 1 week giving it a break. That will optimize the benefits of boron on your free testosterone. There are many myths that you hear often, that a person who was on testosterone developed a heart attack and he died. But essentially, testosterone, when taken in the right amount, is cardioprotective. Both estrogen and testosterone are cardioprotective in the right dosage. I am not talking about these super pharmacological doses which are often taken by bodybuilders, for instance. Increased estrogen causes two things. One is increased body fat, increased visceral fat deposition, and secondly, insulin resistance. Increased visceral fat deposition leads to the enhancement of the inflammatory pathways and brings the inflammatory mediators into play. An aromatase inhibitor, or AIs as we call them, affect the aromatization pathway, decreasing the level of estrogen in the body. Tamoxifen is the first known aromatase inhibitor, but it is non-specific. The specific aromatase inhibitors are anastrozole, or commonly referred to as Arimidex, most commonly referred to in social forums, letrozole or Femara, and raloxifene or Evista. These selective aromatase inhibitors are very toxic. There is nothing positive in them to recommend them to the common man. Aromatase inhibitors are taken with TRT. They are also taken by people who are on finasteride and in whom the excessive testosterone levels lead to aromatization of testosterone into excessive amounts of estrogen. And this is used to placate the symptomatology arising out of excessive circulating estrogen. Bodybuilders use it to reduce visceral fat and to decrease the water retention that occurs because of high estrogen levels, especially before championship events. Some bodybuilders feel that they are like water buffaloes due to their genetics, and this is compounded by enhanced estrogen levels due to TRT. So they seek to shed this excessive water that accumulates because of TRT and which helps them to showcase their bodies better in championship events. Just like TRT increases testosterone, so does finasteride. Many finasteride users take Arimidex to decrease the effects of estrogen like breast puffiness and a host of other effects. Yes, Arimidex is one aromatase inhibitor which is increasingly being used by finasteride users who have high estrogen levels and have breast puffiness and erectile dysfunction as a result. Mostly erectile dysfunction in finasteride users is pre-existing or coexisting, and they fail to understand this fact that in the 25 to 35 age group, 40% of patients have erectile dysfunction for which finasteride is not responsible. Similarly, puffiness of breast or gynecomastia that appears is simply genetic in nature, and taking finasteride can merely unmask the underlying puffiness, the underlying gynecomastia that would, as it is, have occurred later on in life. Blocking estrogen causes harm to the biological systems, more specifically the aromatase pathway. I personally do not feel that one should play with one's hormones so much, taking TRT, taking finasteride, taking testosterone boosters, and then exposing the body to Arimidex. Besides getting a host of side effects, the benefits that you are experiencing with TRT or finasteride may all be lost in the blink of an eye because the body has an innate potential to upregulate or downregulate. Aromatase inhibitors cause micro blisters in vascular networks, referred to scientifically as endothelial tissue. This can cause a walking, talking potential of a heart attack. And then you have this bad cholesterol LDL, which begins to rise. Estrogen has a brain protective effect on the synaptic and dendritic pathways and is also needed for bone and joint integrity. Bodybuilders in the 70s and 80s and the early 90s never took estrogen inhibitors. The dose of Arimidex as taken by patients with breast cancer is 1 milligram in a day. But this dose has toxicity, it has side effects. As far as taking it in a cancer patient is concerned, it's fine. The benefits in cancer patients far outweigh the risks or the side effects. But when you translate this into normal people, healthy people, who are just in search of a healthy lifestyle, taking aromatase inhibitors may not be that advisable. There are certain micro doses in which Arimidex is being used, 0.025 milligrams in a day, but the effectivity has not yet been quantified. So before starting yourself on Arimidex, or before you follow the advice of your doctor, check out the side effects of Arimidex by a simple Google search. Every man who has lived up to 80 is bound to have some sort of prostatic cancer, underlying prostatic cancer or the other. Well, this is a systemic fact, but most of these tumors are benign, and when they are cancerous, they are very slow growing. Supersaturation doses of testosterone, when given to grade 3 and grade 4 prostatic cancer patients, are shown to have caused cell death by a process called apoptosis. So testosterone does not cause or enhance the risk of developing prostatic cancer. This is merely a myth. In fact, the risk is higher for those who have testosterone deficiency. Well, just taking testosterone and not having a dietary plan or an exercise plan to match it is never going to change you into Arnold Schwarzenegger. You have to have a greater plan. Testosterone will merely augment your efforts. Besides its other effects, losing fat in the gym when you're on testosterone will be much easier than otherwise. So in the end, I conclude by saying that before you go on TRT, before you go on finasteride, before you take Arimidex, you have to yourself research about each of these options in your best interest. So thank you for watching. If you have any comment, I will be very happy to answer your questions. God bless you.